My name's Mark Radford. I'm the Director of Nursing Improvement at NHSI. I lead the programme and work on behalf of the Executive Director of Nursing, Ruth May, in terms of the workforce priorities and portfolio across NHS Improvement. So it's great to invite colleagues here today in Birmingham. I know the room layout is kind of odd, but it does work. I've been here before. But the main thing is we've wanted to put on a programme today to really kind of expose and identify some of the issues and challenges we've got in relation to managing workforce across the NHS. Before I go into that, there's obviously a number of sort of normal housekeeping rules apply in relation to here at the Jury's Inn. We don't have a fire alarm plan for today. You will obviously see the green running person signs at the back of the auditorium. If there is an alarm, we'll make way downstairs. We go through the through the lift, down through the stairs, and then there's a muster point out on the front of the hotel. We obviously do have refreshments available through that. Please help yourself. I mean, try not to distract some of the speakers, but if you did want to kind of quickly grab a coffee, but we do have a number of opportunities and breaks during the day. One of the things about these kind of events is it's really important to engage with other colleagues from other parts of the system, and also to kind of ask questions of the panelists and also the contributors today. We've been able to put a number of presentations on today where colleagues are going to be talking about some of the nitty-gritty challenges of running some of our provider organisations. So we will be obviously filming today, because what we wanted to do was kind of live stream this out to colleagues who have been unable to attend the event today. One way we're trying to reduce costs, and utilisation of the digital platforms are one way of doing that. One of our colleagues today will be presenting some fairly challenging own personal experiences of being a leader and executive within a challenged organisation. So we won't be filming that, because we want to create a safe space for them to be able to share their kind of experiences and challenges with you today. So it is a really good lineup in terms of people and colleagues who are going to be talking around their kind of experiences in terms of delivering change and improving outcomes in relation to their organisations. Obviously, all of the speaker notes and presentations will be available later on after the conference today for you to be able to get access to those if there are any questions. We'll obviously do have a number of my team here today in terms of the workforce improvement team as part of NHSI. Those of you who are here, would you put your hand up, please? Tony, yeah, that's you guys down there in the corner. Please, if there are any issues today, do not hesitate to either contact myself or a member of the team, either about the nature and the content of what we'll be discussing today, but also anything in relation to any workforce improvement that we're able to kind of support you with, and also importantly, any issues that arise out of being within this venue. Obviously, we do have refreshments up here. Lunch will be served downstairs in the main restaurant. It's only kind of one flight down, but kind of get you away from the conference centre for a little bit to engage and have a conversation and chat with each other as well. And also room temperature. We never get it right. I don't think I've been to a conference yet. So if I start to see everybody still wearing their coats, it might be too cold. So I will try and do that. If it's a real problem and really affecting your kind of focus today, then please don't hesitate to speak to me, and we'll try and resolve that as best we can, but we can never kind of get it perfect at all. So before we get started, I just kind of wanted to frame today a little bit before my colleague McKay comes and describes some of the kind of rationale behind why we're here. We'll kind of focus on some of the issues and challenges. Workforce is probably the number one risk that all of us, whether we're part of the system or whether we're actually leading organisations, that we face day in, day out. And whilst there are incumbent on us to try and deliver effective workforce solutions within our organisation, that is extremely difficult to get right. And the kind of process that we went through in terms of developing workforce safeguards came out as a number of conversations we'd had with the provider sector over the last 18 months or so, and Emma is going to go into that in a little bit more detail. So today is really the sort of culmination, really, of the launch of the policy document that we put out a number of months ago. We deliberately timed this to, again, give people a chance to be able to read and assimilate what we identified as terms of some of the recommendations within that sort of program, but also then to put on an event like this where we could get senior leaders into a room to really start to explore and understand some of the implications for that kind of boards and also for operational delivery in terms of organisations, but more importantly in terms of kind of from a collegiate sense, how do we deal with kind of some of the issues and challenges we have in relation to the workforce space. So I'd just like to say, thank you very much for your time. I really do appreciate, for many of you, Monday is an extremely busy day. I also appreciate the distances that colleagues have come. The first person who's come up the earliest so far is 4:15. They got up this morning to come to this event today. So I'll be holding a little sweepstake a little bit later if anybody can kind of beat that. Apparently, Emma, you've said that there's a bottle of champagne in it. Is that right? No. It might remind me, Emma, that wins it. So again, I really do appreciate your time and commitment today in terms of this really important agenda. Your feedback is really important. We'll have an opportunity to do that throughout the day, but also a kind of formalised feedback. Again, it's really helpful for us in terms of getting these events designed, created, and also delivered to ensure that they're absolutely making sure that they deliver for you as kind of leaders within the system. So without kind of further ado, I'll hand over to my colleague Emma. Emma is one of the improvement team who work within NHS Improvement, is one of our senior clinical advisors, has extensive clinical and kind of operational experience, and will give us kind of an overview as to kind of how we got here today in terms of the policy and the launch. So warm welcome to Emma. Thank you very much.
Good morning. Thank you, Mark. So, yes, my name's Emma McCoy. I'm currently working with NHSI. I guess I would like to start with saying that I had the great pleasure of working on this document. Now, I'm not saying that because my boss is sat in the corner. It's a genuine pleasure. I'm a director of nursing. I have been a director of nursing in a large acute organisation for many years. So I know the implications of new guidance landing on your desk. Particularly as we draw into the winter. So I think the opportunity that I had to actually influence and shape this document in order that its practical and sort of usability was able to be implemented, hopefully without too much stress and strain for some of my colleagues that work within the NHS organisations. So I guess starting off really, safe staffing, so what? Scrutiny over safe staffing is ever evolving. I guess we would all continue to believe that it is a line of continual improvement. We keep having new guidance that comes out because that's how we learn. We've learned from best practice, and we also sadly learn when things go wrong. Safer staffing really came under the spotlight, I suppose we would probably all agree, after the mid-staff's failings emerged. Back in 2012-13, when Francis then first highlighted safer staffing and links with quality and safety in his report. And throughout the past few years, we've seen more and more guidance come in, more and more expectation relating to that and understanding of what safer staffing looks like. We've had mandated reporting, we've had more transparency around it for us, for our public, for our patients. But again, we keep introducing more and more guidance again as we learn, really. So we started off with Francis having one recommendation linking staffing and skill mix to quality of care, right down to today, where we've got legislation, laws being introduced around safer staffing in Wales and Scotland. So I guess the big killer question is, why on earth do we need more guidance, you would ask? And I don't blame you. And that's partly my first response when we were looking at this. Well, we still have issues. Of course we do. Staffing continues to be a contentious topic for the NHS, and I think we would all agree that we're proud of the care and services that the NHS does deliver, and certainly I'm sure every single one of you is extraordinarily proud of your staff that continue to deliver the care that they do under the circumstances that sometimes they have to deliver that. We know that there have been gaps identified. I've already said that. The more we learn, the more we realise, the more we need to learn. we need more focus and more support for organisations around workforce design and, of course, deployment of staff as well. When we're challenged with funding, we're challenged with supply issues, retention, recruitment of staff, and, of course, all of that leads to morale, and then the consequences are potential patient safety issues. We're approaching another difficult winter. Let's not kid ourselves that it's going to be easier. Things get tougher and tougher. And of course, scrutiny under staffing will continue to be put under the spotlight. There's no question there's a vast body of evidence linking staffing levels and skill mixes to quality and safety of the care that we deliver to our patients. So of course, we need to continue to learn more about that. We're slightly ahead with nursing. We've done more work on that, but of course there are other staff groups involved with delivering care to our patients. And now we've got the Royal College of Nursing actually driving for legislation in the UK around safer staffing laws. So over the past 12 months, I think in particular, but actually since 2012-13, when we started to really have to focus and start to report on safer staffing, we've made a lot of progress. Trusts have made an awful lot of progress. And we've seen that in various places with CQC and HSI, and again, myself as a Don in a big trust. But what we are still struggling with, I guess, is some consistency in how we report and monitor, manage, review, and set staffing workforce plans. So design, implementation, and governance and reporting particularly were issues that we can see a huge variation with across the country. So unfortunately, or fortunately, depends how you look at it, we need to do more work. And that's we, all of us, that's the regulators and provider trusts. And guidance and support was felt to be needed. So our developing safeguards document was born. And it's taken, I would say, 18 months from thought to actually now, here we are today. It was actually developed with system leaders, so it's been well circulated and consulted upon to make sure that we try and support organisations in delivering best practice consistently. So that's really I suppose, concentrating on workforce planning, deployment of staff using evidence-based tools where possible, governance considerations, specifically around redesigning roles and, of course, how we report on staffing, and also the ever-challenging and ever more common responding to unplanned workforce challenges that we all have experienced, and if we haven't yet, we will do for sure at some point, where we have to make some difficult decisions. This document builds on the work that NHSI particularly have done to date, specifically around some sector-specific resource improvement guides that I hope you've all had sight of at some point. I know you're busy, I know there's a lot of information out there, but these are worth having a look at. They are specific, as I said, in certain areas where they offer recommendations and guidance around staffing for those areas. And that's not just the acute, that's also in the community trusts as well. We've developed a workforce planning tool that's, again, helpful in making your strategy and making sure that you plan your workforce, not just the day-to-day business as usual risk management, but the longer-term planning that obviously we need to be thinking about. And then very recently, we've had the development, which we're very pleased about in NHSI, of a Nurse Safer Staffing Fellows programme, which is going to be an academic programme to support education, really, and support around how you evaluate and manage safer staffing. And that's in conjunction with the Shelford Group, which hopefully all of you are familiar with. So some of the key messages in the document. Really, not much of it's new. Hopefully you've realised that if you have had a chance to be able to look at it. It's actually a collation of all of most of the existing guidance that's already in the system, but that we're not that familiar with or not that confident in using. So primarily, it's about the NQB's 2016 guidance, looking at right staff, right skills, right place and time. essentially looking at a triangulated approach to assessment and reviewing of staffing. And we, again, historically have focused on nursing, and that's using evidence-based tools. We know that we need to do more work, and more work is being done with making sure that we have more guidance, really, and evidence-based tools relating to other clinical workforces, such as doctors, AHPs, and other support care staff that deliver care to our patients. The NQB talks about also using professional judgment in support of its staffing reviews, which of course we do all the time, and outcomes, which again is something that all of us would be very familiar with, but making sure they're appropriate in order that we can determine whether our staffing is safe or not. The framework also provides some new recommendations, and that's specifically around reporting and governance. And Lorna, my colleague, will be talking to you in depth about that. And that's important information that I think you'll find extremely useful and very practical to understanding what you do when you leave here today, hopefully take back to your organisations. As I've said already, this is not about just nursing anymore. We realise that it's much more broad. It's every staff group that has any involvement really with care delivered to our patients, and in various settings as well, not, of course, just in hospitals. Another big focus, I guess, with this document was a stronger board engagement, and I think that that's, again, a really critical point. There are some highlights of that, but again, Mark is going to talk you through some of that later on, well, in fact, straight after me. Primarily, though, it's about making sure that we've got an effective workforce plan, because not every organisation has one still. It's updated annually and signed off by the CEO and the exec lead, not just the Director of Nursing, which is historically what's often happened in organisations. And it has to be discussed at a public board meeting, because this is important that our patients understand what's going on and why and how we're staffing and how we've come to those decisions. And then there is another statement within the board expectations that medical and nursing directors need to sign that they're happy that the reviews have taken place, and the outcomes, of course, of that review is something that they can be comfortable with, which is often quite tricky. So, regulation. This is our first real step here in the UK towards regulating some staffing. And who knows, I think it would be highly likely, not sure when it would happen, but legislation will be introduced in the UK. We're running behind Wales and, of course, Scotland probably now as well. So we are asking, NHSI are asking for annual regulatory reporting from April 2019. So that gives us a few months to start to think about what needs to be done in the organisations, and hopefully today will be the platform to springboard you into making sure that you are really clear on that. We thought long and hard about how we do regulate staffing. It's exceedingly complicated and complex, and not just one or two metrics or bits of data will help us to determine what's safe in your organisations, for yourselves or for us, as we know. And we wanted desperately to minimise more regulatory burden. So what we decided was to assess trust compliance using information that's already collected in your single oversight framework, the SOF. And also we've added in a specific workforce statement in the annual governance statement, again, which will give us some prediction of where trusts are in line with some of these, well, these recommendations within the policy. And of course, when we give recommendations for trusts and organisations to adhere to, if they can't or they're struggling, we would be here to offer support. And again, that's in line with the SOF, depending on what elements the organisations have problems with, depends on the type of support that we can offer. But it will be available, and that's either by national teams, so our teams, or the all regional teams who you probably have more contact with going forward. So that's a really high level oversight of the document, where it sort of came from. And then there'll be some more detailed discussions going through the day about actually how you practically implement it and make sure that you're doing what is required for your organisation, and at least understand where your organisation stands in relationship to some of those recommendations. And that's it. Okay. I don't know who I'm handing over to Matt. Right.
Appreciate that.
No problem. Thank you.